We're back now with a healthy way to decrease your medications, gain energy, and lose weight without dieting. In fact, our next guest says it all can be done by reversing type 2 diabetes. And here now to explain is Dr. Greg Hartman. Welcome back, Dr. Hartman.
Thank you.
We've talked about type 2 diabetes when you've been here in the past, but I think that some of this information bears repeating because there are a lot of people out there who are very curious about this and wondering what they can do about it. Why are the rates of type 2 diabetes continuing to rise?
Well, there's a lot of factors that play a role in that. You know, our stressful lifestyles, the American lifestyle, you know, creates a lot of stress on your body. That plays a role. And then, of course, the American diet, the typical American diet puts a lot of stress on the body. And unfortunately, it leads to a lot of type 2 diabetes in our society. So that's a big part of it. The other part of it is the typical treatment for type 2 diabetes. The medications, they just suppress the symptoms. They really don't get to the cause of the problem. And so what you see is the underlying causes just keep churning, and the condition gradually worsens over time.
So this brings me to my next question, because you do approach this differently at your clinic than, as you mentioned, other people might. How does your treatment differ?
Well, what we're going to do is we're going to do thorough testing looking for that underlying cause. So it's more than just taking a blood sugar reading and deciding you have type 2 diabetes and giving you medications for the rest of your life. It's about looking for that underlying cause. So we do more tests, looking at hormones, looking at digestion, really looking for that underlying cause and the triggers. And it's different for everybody. Everybody's a little bit different, obviously, and so what we do is we look for that in that particular individual, then we're going to create a plan based on that individual, an individualized plan, rather than giving everybody the same, you know, 3 or 4 or 5 medications.
Well, if someone has type 2 diabetes, they probably have faced some frustrations because they don't feel like they're necessarily getting better. Is that what you're saying? So what are some of the kinds of frustrations?
Well, they become very frustrated because with the type 2 diabetic, when they initially get it, they get their medications and think, okay, and they start going down the road of type 2 diabetes, not realizing over time, each time when they go in and talk to their doctor, it just gets to be more medications. It gets to be high cholesterol, high blood pressure, the high blood sugars, and they become frustrated because they want to know, well, why do I have this? And they don't know why, and they don't, what do I have to do to get rid of it? And they're told, well, there's nothing you can do, you just have to keep taking the medications. And so that goes on and on and on. Eventually they start, when they have it long enough anyway, they get to having the side effects. They lose limbs, heart attacks, strokes, kidney damage, loss of eyesight, and those are some real serious problems.
Oh, well, what kind of results are you seeing with this different type of treatment?
Well, it's when we look for that underlying cause, what we're going to do is start to address that cause, and that's when you actually see a reversal of that type 2 diabetes. They start to lose weight without exercise because we're normalizing the internal processes, the metabolism. They start to see blood pressure go down, cholesterol go down, hemoglobin A1C goes down, the blood sugar goes down, and it's just a reversal of the condition.
And now, if someone is interested in getting into your program, as you call it, what kind of qualifiers do you use to see that this might help them?
Well, it's really looking at people's motivations and seeing if they're really motivated to think outside the box, so to speak, do some different things that will actually reverse the condition. So we look at that as one of the main criteria.
Before we go, you've got a special offer you want to tell our viewers about. What is it?
You bet. For the first 20 people that call our office, we'll do a no-charge consultation, sit down, talk about their condition, what their situation is, and see if they're qualified for the program, see if it'd be a right fit for them, and then hopefully they can eat some of this awesome food next year without having to worry about their blood sugar.
Yeah, the aroma in the studio right now is overwhelming because we've just been cooking. It's delicious stuff. Well, thank you for coming by again today.
You bet.
It's nice to see you.
It's my pleasure.
And to find out how Dr. Hartman can help you with your type 2 diabetes and more, just call 952-681-2916.